Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, it is the second Tuesday of the month, and on the second Tuesday of the month, we have Dr. Arun Garg as my co-host, and we have some specialists come and talk to you on some important topic which is connected with health. But today, there's an interesting talk that we're going to have, and it's a little different from what we have been talking before. Dr. Garg, as you all know, is a well-known physician. He's the program director of lab medicine and pathology and a clinical professor also. So he has his expertise in the particular field of biomedical field, and he has served for over 4 decades. So today we thought that why not get his expertise to you as to what do we mean by lab medical and biomedical tests and what all is involved in this. So let's get over to Dr. Arun Garg and learn from him today, not as a co-host, but as a guest today. Dr. Garg, welcome to the program. Good evening.
Good evening. It's nice to be with you as always.
Thank you very much. So today your expertise is going to be focused upon because we have always talked about many other things. We have talked about chronic diseases, other things, but when it comes to biomedical field, we don't know much about it. So from your expertise and your experience, we would like to gain this wisdom from you today as to what is this field all about.
Yeah, no, definitely. And it's surprising that I've been on your show for over 10 years now and always been talking about something else, never what is my own specialty. So
Right.
as they say, it's always darkness under the lamp. So I
Absolutely.
think this is really good. I really appreciate the opportunity of sharing with viewers what is laboratory medicine. What is biochemical medicine? That has been my field for 40 years. By the way, I have completed my 40 years, so it's time to move on. So I do not have active practice of medical biochemistry, but I'm still a consultant. I'm still lots of energy, so I still contributing whatever I can. And programs like these are one way of connecting with people. So let's have a look at what is laboratory medicine. As we have talked about integrative medicine and we have talked about body, mind, and intellect a lot, biochemical medicine is the real reflection of body physical part. So it really is a prism or the lens how your body functions. So for body to have imbalance, the functionality disappears. So biochemical medicine and laboratory medicine is a science which allows us to see the imbalance, which allows us to see the derangement of physiological processes. Because that's so important to know what's happening, what we call in our parlance pathophysiology. In other words, what is the basis that you have imbalance? What is the basis you have disease? So most of it has been related to the body part or the physical body part. It does not go into other details as we have talked about. And that's the beauty of it for me. As an expert on the physical body, pathophysiology, and then relate to others has been just a fascinating thing. So laboratory medicine really is a science which allows us to measure imbalance in the body based on pathophysiology.
Okay, that's really interesting. So
Yeah,
So Dr. Garg, it's a wide experience you have had in this field, and there has been a lot of change in this particular field, laboratory medicine. When we say that, when you started and when you just gave up your your practice, can you tell us what changes did you see in all this?
yeah, beautiful. There's been golden era of laboratory medicine last 50 years. Obviously, pathophysiology or understanding science really gave Western medicine its real value as a science. So that has been happening for a long time. People understanding the anatomy, understanding the physiology and its application to pathology. But in last 50 years, there are 2 areas where it has just mushroomed. One is the technology. the ability to measure and ability to analyze has just phenomenally grown. When I first started, some tests used to take 1 hour, simple test. Even like glucose was not very accurate. Accuracy will be 20%, 30%, either way. But in these 50 years, it has now become that we are able to measure these things within 1%, 0.5%. So technology has allowed us to measure these things more accurately, more easily. Like a lot of our viewers would be interested in this glucose meter, the glucose testing they do themselves. So when we first started, that is somewhere around 1984, the errors were so huge that I was involved in writing guidelines when it could be used, when it couldn't be used. The sensors were not very good. The errors were just huge, and it was not worth doing it. But now it's so easy to operate, and errors have reduced to minimal. So now glucose meters can measure within 1% of error, 2% of error. So that has been a huge change. So it's really because of the growth in understanding measurements, understanding the technology. And as you know, industrial revolution brought certain changes, and then information revolution of last 20 years have really changed. So that has been a big change I have seen for good, I must say.
Okay.
And the other thing which has changed, which a lot of people won't appreciate because they don't see the workings of the labs, they just go and give their blood and they don't see, is what we call ability to produce high numbers, automation. And that has really made it possible to have this testing done it in a very reasonable, timely way, and in a very cost-effective way. So that technology has been a big help to the health sciences. It is said now that even though people don't fully grasp it, there are some data which suggest that physicians who depend on these tests to confirm the diagnosis, to make the diagnosis, as many as 70% of the decisions are based on the outcomes of these testings. So just imagine what that means to modern science. And what I really get kick out of it is when we relate this to physical body and the physical medicine, how technology dependent it is. And I've been so fortunate to be part of this journey where we have gone from able to produce maybe 10 or 20 sodiums in an hour to thousands. So it's been a phenomenal progress.
Well, you have been a witness to all this change, the evolvement in this particular field during the past 4 decades. And that's really incredible what you have seen. But Dr. Garg, for a common person, we'll go for a break, but once we come back, tell us from a layman's viewpoint as to, you go to a lab, you give your blood, and then after that, a lot of things come out. The imbalances in the body, what you talked about, are found out. So how are these tests conducted? Like what happens after a person has gone to a lab and the blood or anything else what has been given there comes to the technician, and what all happens over there? So we learn from you after this short break as to what is the process in brief terms, so that a layman can understand how you are able to identify what is lacking in the body, and then it helps the doctor further on to give the prescribed medicine or whatever is required to the patient. So we'll talk all about this after the short break.
हर रंग है साडे को, हर मॉडल, हर एक दी अपनी वक्री पहचान। असीं एक परिवार हाँ, साडा कर्म है अगे वधाउणा, सफर नूं सौखा बनाउणा। बसंत मोटर्स, तुहाडे नाल, तुहाडे करके।
है जुल्म ढाने का अंदाज भी कितना हंसी, हमारी जान पर बनाई है जब जब उसने अंगड़ाई ली। कभी खामोश रहते हैं, कभी शोर होता है। मोहब्बत में शरारत का मजा कुछ और होता है। दिल को जज्बात का तोहफा खामोशियों को बात का तोहफा, खूबसूरती में जड़ी नजाकत अदाओं की चांद से मुखड़े को चांद सा तोहफा।
भारत ज्वेलर्स, सच्चे प्यार की चमक जैसा। पायल बिजनेस सेंटर सरी।
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ। ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਜੋ ਕਿ ਅੱਜ ਸਾਡੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਨੇ ਲੈਬ ਮੈਡੀਸਨ ਦੇ ਸੰਬੰਧ ਦੇ ਵਿੱਚ ਕਲੀਨਿਕਲ ਪ੍ਰੋਫੈਸਰ ਰਹਿ ਚੁੱਕੇ ਨੇ। 4 ਡੈਕੇਡਸ ਤੱਕ ਇਸ ਫੀਲਡ ਦੇ ਵਿੱਚ ਕੰਮ ਕਰਦੇ ਰਹੇ ਨੇ ਤੇ ਅੱਜ ਅਸੀਂ ਇਹਨਾਂ ਨਾਲ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਕਿ ਲੈਬੋਰਟਰੀ ਮੈਡੀਸਨ ਹੈ ਕੀ ਹੈ। ਜਦੋਂ ਤੁਸੀਂ ਕੋਈ ਡਾਕਟਰ ਕੋਲ ਜਾਂਦੇ ਹੋ, ਤੁਹਾਨੂੰ ਕੋਈ ਟੈਸਟ ਲਿਖਦੇ ਨੇ, ਤੁਸੀਂ ਜਾ ਕੇ ਟੈਕਨੀਸ਼ੀਅਨ ਕੋਲ ਚਲੇ ਜਾਂਦੇ ਹੋ, ਉੱਥੇ ਜਾ ਕੇ ਬਲੱਡ ਸੈਂਪਲ ਦੇ ਆਉਂਦੇ ਹੋ। ਉਸ ਤੋਂ ਬਾਅਦ ਕੀ ਹੁੰਦਾ ਹੈ? ਟੈਕਨੋਲੋਜੀ ਅਤੇ ਇਨੋਵੇਸ਼ਨ ਜੋ ਹੈ, ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਕਿਹਾ ਕਿ ਇਹਨਾਂ ਨੇ ਵਿਟਨੈਸ ਕੀਤਾ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਇਹ ਇਵੋਲਵ ਹੋਇਆ ਤੇ ਕਿਸ ਤਰ੍ਹਾਂ ਇਸ ਦੀ ਗਰੋਥ ਹੋਈ ਹੈ। ਸੋ ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਆਓ ਕੁਝ ਹੋਰ ਗੱਲਬਾਤ ਕਰਕੇ ਜਾਣਕਾਰੀ ਲੈਂਦੇ ਹਾਂ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਤੋਂ। So Dr. Garg, as you were mentioning that the technology and innovation has really brought this field to another level, and you have been a witness to that. But a common person, for him or her, a doctor prescribes them to go to get a test done. They get the test done, give a sample of blood, and come back. What happens when it comes to the technician?
Yeah, very much so. Very important question, Harpreet ji. Now, one thing I should use this opportunity to also share with our viewers their role in making sure that the test is done right.
Mm-hmm.
So things like fasting or food you have just before the testing, or exercise you have had, or different drugs you are on, they all affect the test. So
Okay.
it's very important. If people don't remember anything from the today's show, it's important to make sure that they follow the instructions for these tests.
Mm-hmm.
So if the test is to be done in fasting state, that means you haven't eaten anything for X number of hours, then that's how the blood should be collected. Most, I would say, nowadays, 70% of the testing is on blood. Though any fluid, we could do the test, and then also laboratory medicine include histological diagnosis, what the traditional classical pathologist is, but we are talking about what we call clinical pathology.
Mm-hmm.
So I would say first and foremost thing is before you go even to the lab, you must follow the instructions given to you for getting that test done. And most of it is information about what drugs you are on, because drugs affect all different tests. So the interpretation of the test requires that the doctor, when they're interpreting, they take into account. And this is where, like, my field came in. I would be looking at the test, looking at their impact of what all the different drugs person is on and all the results were, and then put a report. So for someone who doesn't get to see the patient ahead, it's very important that that information be available. So I think otherwise you could get misleading results, because most of the results are based on what we call reference values. So reference values are derived when certain conditions, so that has to be there. So that is before you even get the test done.
Mm-hmm.
Then when you have the test.
Here,
sorry.
sir, if I could just interrupt you. Now, that's a very important point that you have touched, Dr. Garg. Many times, you are asked when you go to give the test, what was the last time you ate your food? What did you eat? And as you said, did you exercise and all that? How does that have an impact on whether, it's basically the blood is going to be taken? So does this thing have an impact on, your blood, what you're taking out?
Absolutely.
Okay.
Again, a very good question. And I think this is very good that we are doing this, because this is very practical information for people.
Mm-hmm.
So you are asking, okay, how does it affect that?
Right.
So what we are doing is we're measuring what we call biochemical analytes in blood, which are then affected by your posture, by your drugs you're on, and the food you have eaten, just to name three.
Mm-hmm.
And food, for example, if I'm to measure your glucose in blood, is grossly affected whether if you just happen to have a huge drink of sugar, it's going to be abnormal and it could give a very misleading result. So that's where
Mm-hmm.
fasting becomes very important. Or if we say 2 hour post drink, that means we standardize it and then say, okay, if I give you a load of glucose, how your body responds to it.
Mm-hmm.
So this testing is not only assessing the static state of biochemistry or microbiology or hematology or other things, but also assessing the physiological impact of active state. So that's the beauty of it. So it's a physiological test and it's a functional test.
Right.
And we are able to test all that through this. So for example, a common test is glucose.
Yeah.
And glucose is used for diabetes.
Mm-hmm.
So biochemistry, especially, which is my field, can really go very deep into all these different organs. So metabolic testing for diabetes, high blood pressure, all that is done through biochemical testing. Liver function. So liver, how is liver functioning? This because we're getting so good at it, we're able to diagnose those earlier and earlier and earlier before the true symptoms come. How your kidney functioning? Biochemistry really is the only way to see how your kidney is functioning.
Wow.
How is your heart functioning? Whether you had a heart attack or not. And cardiac, very dear to my heart, pardon the pun, is how the progress which has been made. When I first started, used to take 72 hours to make a diagnosis whether you have a heart attack or not on a biochemical basis. So that means you are in emergency waiting 72 hours because you had to have 3 different sample collected and do the testing. Now we could do it in 2 hours, baseline and a 2-hour result, and the difference can tell you whether you had a acute heart attack or not. So we have come a long ways that way.
Right.
Now your question was what happens when a person goes to the lab.
Right.
So the first thing is make sure you give all your history as requested. So for example, glucose fasting or not. People get a lot of tests done under metabolic things about thyroid. That's a very common test. So whether you are taking any thyroid medications or not is very important because it affects the test. So you have to make sure that the person taking your history and taking your blood knows this so they can make that note. So then that stays in your history as the process of finding the results. So after a specimen is taken, it's what we call pre-analysis.
Right.
So it has to be processed. And that's a very sophisticated exercise. Even a simple thing like people say those tubes in which the blood is collected are a real medical device. The kind of coagulant they have, kind of coating on the tube they have, they all affects. And how the tube is stored, whether it's stored standing or lying will make a difference. So we have to have all that standardized. And I'm very happy to share that our standards are so high that it's all standard orders of procedures and accreditation. So it's all followed to the hilt. And that's what our people are trained to do. So you're in good hands when that is done. And then now the specimen is collected. Then majority of the tests now done by machines, highly automated machines. There's some manual testing for rare tests, but majority of the tests are done by manual testing. So those specimens are then put on either robots or automated analyzers. And then it's a really high production industrial work. But important thing is that behind every test, behind every tube, there is the individual. So us who are working in the lab are very much aware of that.
Right.
So every step, so much details are looked after that there are no errors. There are no errors of communication. There are no errors of transcription, how you're writing. So again, computers have really helped. So
Right.
nowadays,
Now, this was my
you're
next question, because there are thousands of tests that are done which come to the laboratory where they are checked. So as you said, you know, that how is it that they don't get mixed? What all process happens over there? And luckily I also have a laboratory requisition form with me, and it talks about hematology, urine tests, chemistry, lipids, hepatitis, and a lot of other things. So we'll go for a break. Once we are back, I would like to learn a little bit more in details, because what you are telling is really interesting and probably nobody knows, because we just go to a laboratory, give a test and come back and see the results, and just the doctor tells us, your cholesterol is more, or you are having this issue or that issue. But what happens behind the curtains, what you are sharing with us, is very, very important. So thank you for that, Dr. Garg. Let's go for a break. We'll be back in the last segment. We'll learn more from you about all this process, and as you have very rightly mentioned, what people should know before they go and give a test, or during the time, whatever their information they have, they should share with that person, so that the right kind of test can be performed. So we'll be shortly back and continue with the discussion.
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਐਕਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ, ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਵੈਨਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 13042 84 ਐਵਨਿਊ ਸਰੀ। ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363। ਹਰ ਇੱਕ NRI ਪੰਜਾਬੀ ਦੀ ਇਹ ਚਾਹ ਹੁੰਦੀ ਹੈ ਕਿ ਉਹ ਅੰਮ੍ਰਿਤਸਰ ਜ਼ਰੂਰ ਆਵੇ, ਇੱਥੇ ਆ ਕੇ ਮੱਥਾ ਉਹ ਟੇਕਦਾ ਹੀ ਹੈ। ਐਂਡ ਆਫ ਕੋਰਸ ਅੰਮ੍ਰਿਤਸਰ ਜੇ ਆਈਏ ਤੇ ਸ਼ਾਪਿੰਗ ਨਾ ਕਰੀਏ, ਇਹ ਤਾਂ ਆਫ ਕੋਰਸ ਸੰਭਵ ਹੀ ਨਹੀਂ ਹੈ। ਪਰ ਹੁਣ ਸਾਡੇ ਵਾਸਤੇ ਸਾਰਿਆਂ ਹੀ ਲਈ ਇੱਕ ਖੁਸ਼ਖਬਰੀ ਹੈ ਕਿ ਅੰਮ੍ਰਿਤਸਰ ਦੇ ਵਿੱਚ ਮਾਲ ਰੋਡ ਦੇ ਉੱਤੇ ਇੱਕ ਬਹੁਤ ਹੀ ਵਧੀਆ ਸਟੋਰ ਜਿਸ ਦਾ ਨਾਮ ਹੈ ਅਨਿਲ ਸਟੋਰ, ਉਹ ਖੁੱਲ ਚੁੱਕਿਆ ਹੈ, ਜਿੱਥੇ ਕਿ ਲੇਡੀਜ਼, ਜੈਂਟਸ ਅਤੇ ਬੱਚਿਆਂ ਦੇ ਤੁਸੀਂ ਸਟਿਚਡ ਅਤੇ ਅਨਸਟਿਚਡ ਕੱਪੜੇ ਖਰੀਦ ਸਕਦੇ ਹੋ। ਸੋ ਮੈਂ ਆਪ ਸਭ ਨੂੰ ਬੇਨਤੀ ਕਰਦਾ ਹਾਂ ਕਿ ਖਾਸ ਤੌਰ ਉੱਤੇ ਜਿਹੜਾ ਮੇਰਾ ਪ੍ਰੋਗਰਾਮ ਦੇਖਦੇ ਹੈਗੇ ਨੇ ਕਿ ਜਦੋਂ ਵੀ ਅੰਮ੍ਰਿਤਸਰ ਆਓ ਤਾਂ ਇੱਥੇ ਆ ਕੇ ਜ਼ਰੂਰ ਸ਼ਾਪਿੰਗ ਕਰੋ ਅਤੇ ਬਹੁਤ ਹੀ ਵਧੀਆ ਕੀਮਤਾਂ ਤੇ ਤੁਹਾਨੂੰ ਇਹ ਸਾਰੇ ਚੀਜ਼ਾਂ ਮਿਲ ਸਕਦੀਆਂ ਨੇ। ਹੇਠ ਲਿਖੇ ਐਡਰੈਸ ਅਤੇ ਫੋਨ ਤੇ ਤੁਸੀਂ ਫੋਨ ਵੀ ਕਰ ਸਕਦੇ ਹੋ ਕਿ ਜੇਕਰ ਅੰਮ੍ਰਿਤਸਰ ਨਹੀਂ ਆ ਰਹੇ, ਈਵਨ ਕੈਨੇਡਾ ਵਿੱਚ ਰਹਿੰਦੇ ਹੋਏ ਵੀ ਤੁਸੀਂ ਇਹਨਾਂ ਨੂੰ ਫੋਨ ਕਰੋ ਅਤੇ ਇਹ ਤੁਹਾਨੂੰ ਆਨਲਾਈਨ ਸ਼ਾਪਿੰਗ ਵੀ ਕਰਵਾ ਸਕਦੇ ਹੋ। Once again, welcome back to the program. This program is being brought to you with the support of AMC Insurance. If you're looking for home, auto, travel, business, life or recreational insurance, they have 9 branches in the lower mainland to serve you, and they're open 7 days a week from 9 a.m. till 9 p.m. For more information, call 604-507-6666. Our next sponsor is Agnihotri Immigration Consulting. Temporary status PR ਨਵੇਂ ਹੋ ਕੈਨੇਡਾ ਵਿੱਚ ਅੰਤਰਰਾਸ਼ਟਰੀ ਵਿਦਿਆਰਥੀ ਹੋ, ਤੁਸੀਂ ਵਰਕ ਪਰਮਿਟ ਬਾਰੇ ਜਾਣਕਾਰੀ ਲੈਣੀ ਹੈ ਜਾਂ ਫਿਰ ਸਪਾਂਸਰ ਕਰਨੇ ਨੇ ਪੇਰੈਂਟਸ ਜਾਂ ਗ੍ਰੈਂਡ ਪੇਰੈਂਟਸ, ਤੁਹਾਡੀ ਮਦਦ ਕਰ ਸਕਦੇ ਨੇ ਨੀਰਾ ਅਗਨੀਹੋਤਰੀ, ਜੋ ਕਿ 2006 ਤੋਂ ਸਰਟੀਫਾਈਡ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਸਲਟੈਂਟ ਵਜੋਂ ਕੰਮ ਕਰ ਰਹੇ ਨੇ। For honest and reliable information, she will guide you, and you can call her at 604-597-2284 604-597-2284। ਅੱਜ ਅਸੀਂ ਬਹੁਤ ਹੀ ਇੱਕ ਇੰਪੋਰਟੈਂਟ ਐਸਪੈਕਟ ਤੇ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਹਾਂ, ਮੈਡੀਕਲ ਬਾਇਓਕੈਮਿਸਟਰੀ ਹੁੰਦੀ ਕੀ ਹੈ। ਉਸ ਸੰਬੰਧ ਵਿੱਚ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ, ਜੋ ਕਿ ਪਿਛਲੇ 40 ਸਾਲਾਂ ਤੋਂ ਇਸ ਫੀਲਡ ਵਿੱਚ ਕੰਮ ਕਰ ਚੁੱਕੇ ਨੇ, ਉਹ ਅੱਜ ਸਾਡੇ ਨਾਲ ਆਪਣੀ ਵਿਜ਼ਡਮ ਸ਼ੇਅਰ ਕਰ ਰਹੇ ਨੇ ਤਾਂ ਕਿ ਅਸੀਂ ਜਦੋਂ ਲੈਬੋਰਟਰੀ ਵਿੱਚ ਜਾਂਦੇ ਹਾਂ, ਟੈਸਟ ਦੇ ਕੇ ਆਉਂਦੇ ਹਾਂ, ਹੁੰਦਾ ਕੀ ਹੈ, ਉਸ ਤੋਂ ਬਾਅਦ ਕਿਵੇਂ ਉਹ ਟੈਸਟ ਦੇ ਰਾਹੀਂ ਪਤਾ ਲੱਗਦਾ ਹੈ ਕਿ ਸਾਡੇ ਬਾਡੀ ਵਿੱਚ ਕੀ ਇੰਬੈਲੈਂਸ ਹੈ, ਜੋ ਕਿ ਫਿਰ ਡਾਕਟਰ ਜਦੋਂ ਉਹ ਟੈਸਟ ਦੇ ਰਿਜ਼ਲਟਸ ਦੇਖਦਾ ਹੈ ਤਾਂ ਉਸ ਤੋਂ ਬਾਅਦ ਸਾਨੂੰ ਰਿਕਮੈਂਡ ਕਰਦਾ ਹੈ ਕੋਈ ਵੀ ਦਵਾਈ ਜਾਂ ਕੋਈ ਵੀ ਚੀਜ਼ ਜਿਸ ਨਾਲ ਕਿ ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਸਿਹਤਮੰਦ ਰੱਖ ਸਕਦੇ ਹਾਂ। ਸੋ ਇਸ ਸੰਬੰਧ ਵਿੱਚ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਨੇ ਜੋ ਦੱਸਿਆ ਕਿ ਜਦੋਂ ਅਸੀਂ ਪਹੁੰਚਦੇ ਹਾਂ ਲੈਬ ਦੇ ਵਿੱਚ ਤਾਂ ਸਾਨੂੰ ਦੱਸਣਾ ਚਾਹੀਦਾ ਹੈ ਟੈਕਨੀਸ਼ੀਅਨ ਨੂੰ ਕਿ ਜੀ ਅਸੀਂ ਖਾਣਾ ਕਿੰਨੇ ਟਾਈਮ ਪਹਿਲਾਂ ਖਾਧਾ, ਕੀ ਕੁਝ ਖਾਧਾ, ਤਾਂ ਕਿ ਜਿਹੜਾ ਟੈਸਟ ਹੋ ਰਿਹਾ ਹੈ ਉਸ ਦੇ ਵਿੱਚ ਕੋਈ ਕਮੀ ਨਾ ਰਹਿ ਜਾਏ। ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਲੈਟਸ ਕੰਟੀਨਿਊ ਵਿਦ ਆਰ ਡਿਸਕਸ਼ਨ। So Dr. Garg, that's really interesting what you are telling. And now once these samples have come to you, so basically it's fluid sample like blood is taken or urine is taken or stool is taken. So from this, as I see in front of me the form, the requisition form, this talks about hematology, it talks about the urine test, it talks about the chemistry, it talks about the microbiology, and in which routine culture, again a lot of further it is talking about stool specimens, mycology, it talks about hepatitis serology. So these things, lipids. So just by these samples you can find out everything, the imbalance in the body, what is happening, like you talked about cardiac arrests also. So through tests you can find out that what is wrong in the system.
Absolutely, that is the pathophysiology.
Right.
In medical terms, we talk about whether you have infection or not, whether you have inflammation or not, whether you have cancer diagnosis, neoplasm, or degenerative diseases. So all these tests are designed to differentiate between those tests, and that's why they are so critical. And by testing, we get very good insight. Obviously, in medicine, everything has to be put together with the history and physical exam. So you never make a diagnosis just on the basis of a test. It has to make sense in the total history and physical exam. That's why the collaboration between your physician and the laboratory physician is so critical. But you're right, most of the tests are designed to make these precise diagnoses.
So how do you prevent that error, that there's no mixture of the so many blood samples which have come to you and you check them?
Yeah, so obviously before technology was there in terms of IT, there were some errors, and most of the errors in the laboratory are related to what we call pre-analysis. So sometimes mix up and labeling and all those things, but we have put so much emphasis on minimizing those that there is zero tolerance. And essentially, right from the time you enter, and I'm sure you have had opportunity to give blood testing, they always ask you, what is your name? Even they know, but they ask you for you to say, and that is a check. They ask you, what is your date of birth? So that's another check. So there has to be two very clear identifiers. And in British Columbia, everybody has a unique MSP number. So then that is checked. So all that is put into computer. And that computer then generates a bar scan or code. And that code then follows all the way through the life history of that specimen.
Right.
And always checked and flagged. So chances of error because of the mix-up have just about disappeared. I'm not, obviously, there is always 1 in million, but so that is it has come long ways. Right. And because of this, one is able to then do a lot of these tests, you know. The other thing which is unique in laboratory medicine is after the test is done, many times it's the analyzer which is doing it, but then you have to put a report together. And what these numbers mean have to be indicated. And that's based on the reference values. And this is of great interest to us and to me personally. And reference values require that the population you're studying be the same on which you're testing.
Right.
And this is where I would put a plug in for our community that majority of the work has been done on European population, but more and more now we are collecting specimens from different segments of population.
Right.
So ethnic diversity, geographical diversity, because they all affect your normal results. Uh, uh, um, a 6-foot person has different parameters than a 4-foot person, and I think
Right.
to have the same reference values don't make sense. Body mass, muscle mass, and so biochemical parameters which are affected by muscle mass are reflected. So all that has to be taken into account, and
Okay.
I'm happy to share that that is incorporated in the reports. So
Okay.
it's like a black box. You've done it, but you don't know what's happening. But they're in good hands. There is a
Right.
lot of care goes into it, and I was so privileged to be part of the system for so long and design it. So, for example, in Fraser Health, we have a standardization. So it doesn't matter which hospital you go to, test is done by the same methods. So that's
Okay.
another piece of contribution. It's not like different tests, right? That's why
Right.
it's important that if you are using a particular lab, that you continue to use that lab because of standardization. So those are the subtle things. Fasting is important, diet is important, drugs are equally important, and then nowadays you could request your results, so then you get a report. So you should take interest in it, and I would encourage people to take interest.
Right, Dr. Garg, that's very informative. But again, there is another question which is coming to my mind, and I think no question is small or big. But as you talked about innovation and technology, in the future, do you think that machines will replace humans, and these tests will be just going into the computers, and everything will be done on its own, or has it already started now?
Well, that is a $64 million question, and you're going to get my view on it. Everybody have their view. I would say no technology will ever replace human mind. What it does, it allows human mind to be innovative, to do more, do better, but still technology works under that human mind. So I have no doubt that human mind will ever be replaced,
Yeah.
because that's where the innovation has come from. And I saw that in 45 years, 50 years of my service.
Right.
If anything, we needed more people. As we introduce technology, now technology has to be maintained, technology has to be controlled, technology has to be make sure. Well, just recently, for example, you had the breakdown on the internet. Uh, it was the human mind which brought it back. So no, I don't think that technology will replace humanity or human mind, but it will allow. So then it's an equalizer.
Right.
What was available, say, only to 100 people, now is made available to million people. So
Right.
that's where technology does. So it's a
Okay.
very, in my mind, very positive
Right.
aspiration.
See, there are so many questions which are still coming to mind, but time is not permitting me. But there's one question which I would like you to answer before we just talk about the recently concluded CINI conference. Dr. Garg, when from the blood, you put some chemicals, and then whatever test you're conducting, you get the result for that. So is it the same chemical for everything, or for every test there is something different that has to be done?
Again, so you're asking some very good questions today, I must say. Yeah.
Thank you.
Oh no, it's very specific. See, because each test is very specific, so chemicals are all very different, and different way we test. So some of them are chemical reactions, some are physical reactions. So we are measuring charges, electro charges. Some are immune related. So most of the microbiology, and especially in the COVID testing, is immunological testing. So
Right.
very specific antigen, antibody. So they're all very specific for that test.
Okay.
It's not like you take the same test, put that drop, and you get 100 tests out. No. Each test is own. And that's why you need all these people, you need all the knowledge, and that's why you need people like me give their professional career to make sure it goes
Right.
on.
Well, thanks to this evolving technology and individuals like you who have spent their entire life working on these aspects and bringing better life quality to the common people. So thank you very much. But before I let you go, Dr. Garg, recently the CINI 2022 conference concluded, and we saw for 3 days. I had the pleasure and honor of listening to some top stalwarts on different issues. So post conference, what would you like to tell us that whatever was talked about over there, what is happening now?
So I think, as you know, our theme this year was women's health, and in women's health there were some very good sessions shared, and one big was follow up is on cancer. So early diagnosis of cancer and how to lower the barriers for South Asians with that lens. So we'll be working with Cancer Agency and Dr. Lisa Dawson on that project. It's a very, very positive outcome, you know. Diabetes was another area, gestational diabetes. So working with Dr. Reena Khurana with the South Asian community, what are the barriers? So the whole thing was designed how to lower the barriers for better health from a woman's health perspective. So that will be there. Then the other one, which we alluded today a little bit, and that is the reference values or the research or inclusion of ethnic and cultural specificity in diagnosis. So those are some of the areas we'll be carrying on collaboration work.
Right.
And the other area is obviously integrative thinking, and we are hopeful that some of that course material can be incorporated in our own teaching for healthcare workers of integrative thinking. So all in all, it was very positive and very thank all the participants and all the people who joined. Thank you for promoting it, and I think we got a very good turnout.
Oh, yes.
There were 250 people who registered at any given time. 70 or 80 people were in attendance, different
Right.
people. So I think all in all was very good, and
Absolutely.
it's all on our web, and it's all on our website. If
Right.
anybody missed it, all the sessions are recorded, and they are on YouTube channel, CINS YouTube channel, and people can go there and listen.
Right.
And it's just the CINS YouTube, and they'll get all the sessions.
Great. So congratulations to you and your entire team who made this a grand success. And of course, we are waiting eagerly for the next conference. And Dr. Garg, before I let you go, as far as medical biochemistry is concerned and what we have touched today, in conclusion, if you would like to add anything.
I would say most important thing is take interest in your health and empower yourself with that knowledge, and lab test allows you that. So you should take interest in it and try to understand what it means, and especially give all the information which could affect the test so that appropriate interpretations can be made.
Wonderful. Dr. Garg, it was a pleasure as always having you on the show and talking about important topic. And this probably, I think, has never been touched anywhere. So definitely this will go a long way in helping the people make decisions as to why they should get themselves examined and of course get these tests so that they can find if there is any imbalance in the body and then rectify that. Thank you very much and have a good evening.
Yeah. Thank you. Thank you for having me. And I'm hoping that through these sessions, we could also increase awareness and interest of both of the providers and the patients. So then there is a better interaction.
Very true. Absolutely. Thank you, sir. Thank you very much. ਸੋ ਇਹ ਸਨ ਸਾਡੇ ਅੱਜ ਦੇ ਮਹਿਮਾਨ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ, ਜਿਹੜੇ ਕਿ ਜਿਨ੍ਹਾਂ ਨੇ ਦੱਸਿਆ ਸਾਨੂੰ ਮੈਡੀਕਲ ਬਾਇਓਕੈਮਿਸਟਰੀ ਕੀ ਹੁੰਦੀ ਹੈਗੀ ਹੈ। ਜਦੋਂ ਤੁਸੀਂ ਬਲੱਡ ਦਾ ਟੈਸਟ ਦੇ ਕੇ ਆਉਂਦੇ ਹੋ ਜਾਂ ਯੂਰਿਨ ਟੈਸਟ ਦਿੰਦੇ ਹੋ ਜਾਂ ਸਟੂਲ ਦਾ ਟੈਸਟ ਦਿੰਦੇ ਹੋ, ਉਸ ਤੋਂ ਬਾਅਦ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਇਹ ਚੀਜ਼ਾਂ ਦੇ ਉੱਤੇ ਕੰਮ ਕੀਤਾ ਜਾਂਦਾ ਅਤੇ ਉਸ ਤੋਂ ਬਾਅਦ ਜਿਹੜੇ ਇੰਬੈਲੈਂਸਿਸ ਨੇ ਬਾਡੀ ਦੇ, ਉਹਨਾਂ ਦੇ ਬਾਰੇ ਰਿਪੋਰਟ ਕੱਢੀ ਜਾਂਦੀ ਹੈ ਅਤੇ ਫਿਰ ਡਾਕਟਰ ਨੂੰ ਭੇਜੀ ਜਾਂਦੀ ਹੈ। ਜਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰ ਨੇ ਗੱਲਾਂ ਜੋ ਕਹੀਆਂ ਕਿ ਤੁਸੀਂ ਜਦੋਂ ਵੀ ਜਾਂਦੇ ਹੋ ਤਾਂ ਜ਼ਰੂਰ ਸਪਸ਼ਟ ਤੌਰ ਦੇ ਉੱਤੇ ਦੱਸੋ ਆਪਣੇ ਉਸ ਟੈਕਨੀਸ਼ੀਅਨ ਨੂੰ ਕਿ ਕੀ ਕੁਝ ਤੁਸੀਂ ਖਾਧਾ ਹੈ, ਕੀ ਨਹੀਂ ਖਾਧਾ, ਤਾਂ ਕਿ ਜਿਹੜਾ ਤੁਹਾਡਾ ਟੈਸਟ ਹੋ ਰਿਹਾ ਹੈ, ਜੋ ਡਾਕਟਰ ਨੇ ਰਿਕਮੈਂਡ ਕੀਤਾ ਹੈ, ਸਹੀ ਹੋਏ ਅਤੇ ਤੁਹਾਨੂੰ ਸਹੀ ਰਿਜ਼ਲਟਸ ਮਿਲ ਸਕਣ। ਤੁਹਾਡਾ ਮੇਰੇ ਸਾਥ ਹੋਇਆ ਕਰਦਾ ਹੈ ਮੰਡੇ ਟੂ ਫਰਾਈਡੇ ਸ਼ਾਮ ਦੇ 6 ਵਜੇ ਪੈਸੀਫਿਕ ਸਟੈਂਡਰਡ ਟਾਈਮ ਦੇ ਮੁਤਾਬਿਕ। ਇਫ ਯੂ ਆਲਸੋ ਵਾਂਟ ਟੂ ਬੀ ਅ ਪਾਰਟ ਆਫ ਦਿਸ ਪ੍ਰੋਗਰਾਮ, Anywhere in the world you want to contact me, you can WhatsApp me at 604-603-7555, or you can email me at harpreetsingshow@gmail.com. Once again, thank you very much for sparing your valuable time and being a part of this program. And thanks to all of you, we are growing. We are now having 17,000 subscribers who watch this program every day. So I'm indebted to you. Thank you very much. And if you have any idea which you feel needs to be touched upon, please do contact me. Have a safe evening, stay healthy, and enjoy yourself.